this report.
Breast and cervical cancers are believed to be the most common types of female cancers in Senegal, and so news that chemotherapy to treat them will be free has resonated positively.
I'm really happy about it. It's really something that should be applauded. It's exceptional because there are so many women who have cancer and can't pay the treatment. They could die, but now it's free. We have to thank God, really.
Not all types of treatments will be free, but this measure could help 80 to 90% of patients.
Often with chemotherapy, the drugs represent 80% of the total cost of treatment paid for by the patient. So if we make the drugs free, nearly all the treatment is free.
The government also says it is subsidizing some of the drugs needed to treat side effects of chemotherapy, but critics say it is not enough to effectively reduce cancer mortality. Before considering chemotherapy, patients need to consult a doctor. That's about $5. Then they have all sorts of tests to do. Those can cost up to $1,600. If the patient gets free chemotherapy, it usually doesn't stop there. They often need surgery as well. That's about $330. And sometimes radiotherapy. That's about $250. This is our Florence. She was diagnosed with cervical cancer last year. She has gone through 4 cycles of chemotherapy already.
It's really expensive. When all this started, I had to sell everything I owned. I don't have anything left. I am a widow and I don't have the means to pay for further tests.
She is hopeful this new initiative will help her, but she also has some reservations.
Sometimes you have drugs that you need to buy urgently, and you can't go to the Anti-Cancer League or to the government. We don't know yet. They say it's for free, but we don't know if we will need to fill out paperwork here and there. We don't know. And if it's urgent.
While this measure is a good first step, experts say that effective cancer management requires addressing healthcare as a whole. Louise Doast, BBC News, Dakar.